Hi, I'm Dr. Fletcher Thierry from examsolutionprovider.com. I'm continuing with these tutorials aimed at helping those student nurses who require numeracy calculation skills. This is test 2.8. Which means chapter 2 of this book. All the questions are from this book, which is a numeracy and clinical calculations for nurses by Neil Davison. Okay. The aim of these tutorials are more to help those students who are going into nursing and those who are actually going to access courses, probably whose interviews involves some numeracy skills. Also, it is trying to help remove the fear that mature students have, as many of, or majority of these students who enter into nursing as mature people, one of the things they fear is actually maths, because in most cases, maths, they are seen as numbers, not as language for communication. Also, they'll be able to appreciate why they need to learn maths, particularly to help reduce medication errors. Medication are extremely important because they help us to get better when we are not feeling well, but also equally they are very dangerous if we do not actually take them correctly. One of the major problems is error in calculating the doses that actually patients need. What we need to know is that the doctors prescribe medications, as these are in milligrams or can be solution volumes, but the nurses, they need to figure out, they need to calculate the actual dose that is going to be given to a patient. Now, if they give too little, then medication is not going to work. Therefore, patient will take longer to get better. So that's not helpful because it's just a waste of medicine, but also it does actually have impact, negative impact on the patients and their family because they stay in the hospital longer where they are not working. So that's not helpful. To the hospital itself, like NHS, is also not going to be a good thing, because many of these patients, they just actually occupying the beds. So it will end up having congestion in the hospital. If you give above the normal, what is required doses, medicine is going to be dangerous. They can damage the liver, damage the kidney, and all other organs, and then they can kill the patient. Okay, so some patients are more vulnerable; they are at more risk than the others. For example, children and young people, the toddlers, they are very, very at a higher risk of actually, if you give the wrong doses, they're more likely to damage their organs or damage their liver, and they will make them even worse than what they should have, they would have been. Also, the elderly people who are older, those of you, they will need to be careful, make sure they're given the right doses. And then the others with underlying conditions, like, for example, women who are pregnant, but also those with chronic conditions. We need to be careful what we give, actually how much medication we give them. Give them correct doses is extremely important. Okay, and also it helps to reduce what is called medication error. Medication errors, one of the causes is actually giving patients a wrong dose, which means you have calculated wrongly, then that's not going to be helpful to the patient. So it will lead to poor patient experience, so which is not good for nurses. Right, okay, so generally you're going to see that the mathematical skills are extremely important. In terms of clinical calculations, we're talking about the intake of fluids. You may have to actually calculate the volume of how much fluid the patients need for 24 hours. And also you may have to record how much the patient is actually losing, which is output. So we need to look at input, output, And also some of the things like, for example, how to calculate the BMI to help the doctors. We also tend to take a temperature. So recording temperatures accurately requires some way of calculating, make sure that you give the right temperature. Otherwise, if you don't, then doctors may end up making decisions on wrong information. So that's not helpful. There are a lot of other things, blood pressure. So calculated blood pressure recording is extremely important. So you can see that obviously why they insist that nurses, they need to have numeracy and clinical calculation skills. Very, very important. Okay. If you have any problem, then let me know. You can actually go to examsolutionprovider.com. You'll be able to find me and my contact details. You can come back. I provide this tutorial support to students who are actually doing studying for nursing, access to nursing, as well as other subjects. So if you go on my website, you'll be able to find the information and you can get hold of me. Right. Okay. So as I said, this is test 2.8. I'm not interested in going through the whole of this book or page by page. No. What I'm interested in is the self-assessment tests, which are tests at the end of each chapter. So therefore, what I'll be doing, not at the end of each chapter, but at the end of each section, because this is each chapter is split into sections. So obviously, you're going to see to help if you are actually revising for your exams. For example, nursing training, associate trainees, this actually is a module on its own. They are supposed to actually pass this in order for them to progress. All right. Okay. So let's get on.